This segment is brought to you by Royal Quartz, where nature and technology fuse, timeless elegance and beauty emerge.
Depression is a serious issue in our society, and if left untreated, can lead to the loss of life. We speak to Dr. Salduka to find out more.
Dr. Salduka, thank you so much for joining us on Living Your Best Life.
It's a pleasure. Thanks for having me.
So we're going to talk about depression. We hear this word constantly on social media, in society, but I think we need a better understanding about what this is. So can you explain to us what depression is?
Well, I think the most important thing is that depression is a medical condition. And I think the perception is that depression is the same as sadness or the same as unhappiness or going through a tough time. That's not the same. Sadness is an emotion, depression is a medical condition. Yes, people who are depressed get sad, but not always. They can also be angry. So it's a medical condition that affects specific parts of the brain and causes a specific series of symptoms which can render a person unable to do most things in life, become dysfunctional. And the flip side is that because it's medical, it can be treated and all the symptoms can go away and they can resume a normal life.
Are there different types of depression that's around?
Yeah, so depression is what we call a spectrum condition. So you can have people that fall into different parts of a spectrum, from mild to severe with psychotic features and so on. So you get what is called unipolar, which is just depression. And then you get bipolar depression, which is patients who have depression. And then the opposite of depression, which is a manic high or mania or hypomania.
So when we talk illnesses, we talk about the seriousness or the severity of it. Is depression a serious condition?
Absolutely. I mean, I think any condition that leads to the loss of life is serious, and depression causes people to become suicidal. That's the end point of severe depression, is where people reach a stage where they feel helpless and hopeless and they can't see a way out and they end up taking their lives. So the precursor to more than 90% of suicides is depression. So of course it's a very serious condition.
And finally, let's talk about some of the treatments available.
Well, over the years we've kind of built up quite a significant amount of options. So obviously the first port of call is medication. Depending on how severe, because with mild depression, like just mild symptoms, you can possibly get away with counseling and psychotherapy, which is a modality of treatment. But as it gets more to the moderate to severe symptoms, which make a person quite dysfunctional, it's almost imperative that you're going to need medication. So we have what we call antidepressants. They fall into several classes, some of which are tricyclics, the selective serotonin reuptake inhibitors, and the serotonin noradrenaline reuptake inhibitors. All that means it just identifies which neurotransmitter in the brain that drug works on. And that's one mode of treatment, is the antidepressants. Then we have what is called neuromodulation. And neuromodulation means you use an electrical impulse to activate, because remember the brain is an electrical organ. It relies on electrical impulses to function. So you started using methods of inducing electrical changes. The oldest and most well-known is electroconvulsive therapy, which is an extremely safe and effective form of treatment for depression. Again, a lot of stigma and negative press around it. People have a false impression. It's actually extremely safe and extremely effective. And then of course there's psychotherapy, which is counseling, talking, understanding where this comes from and connecting it with your past and your present. We have psychologists that do psychotherapy and psychiatrists that do psychotherapy. So the modalities of medication, the modulation and psychotherapy are what we have at our disposal.
The importance of not self-diagnosing yourself as someone that has depression.
Look, I would say if you think you're depressed, don't diagnose and treat it yourself. Go and get help.
Well, thank you so much for joining us today. It was very enlightening.
Thank you.
Thank you.
Royal Quartz products are engineered to produce exceptionally high-quality surfaces, which combine superior aesthetics and unsurpassed strength. Virtually maintenance-free makes them the practical choice for commercial and residential interior applications.